Namaste to all of you. In Ayurveda, to treat any disease, of course, we must diagnose the disease first. But in Ayurveda, we say not only you have to diagnose the disease, but also you must diagnose the patient. That we call Rogi Pariksha. Therefore, we have developed eightfold and tenfold examinations. And by doing that, still we need to know more about patient's central nervous system. We must examine the higher function of central nervous system. We should examine the cranial system. We must examine sensory system. So this all gives us a pretty good idea of patient's central nervous system. To know higher function of central nervous system, we have to find out the level of consciousness, his awareness of time, place, person, his memory, his speech, his intelligence. This is done by questioning the patient. You must ask patient what is his name, how he has come here, with whom he has come, what type of function, what type of work he is doing. So that way, if patient answer and tells you his name, if we can tell you that since when he is suffering from the disease, and if he can tell you that he has come with his father or mother or his wife or his son, so then we can see that patient's level of consciousness about time, about the place, and about the person himself is quite good. His memory is good. His speech tells you that if his articulation is good, if he is intelligent or not. So doctor has to ask few questions to know this all. That we call level of consciousness. That how conscious he is, how aware he is about the time, place, where he is living, what he is going through, if he can tell you that. So, of course, it's done by questions, but also it's the doctor's own observation. So, after examining the higher function of central nervous system, then therapist or doctor should examine all the cranial nerves. We know that we have got 12 cranial nerves, and that connects your brain to different parts of your head, neck, and trunk of the body. And they have got specific function to do. By examining the function of all the nerves, we know that how healthy central nervous system is functioning. So first of all, we have got olfactory nerve. Olfactory nerve, we know all that it transmits sensory information to your brain regarding smell. So it can be tested very easily to let patient smell something what is very common and known to all, like menthol, eucalyptus, things like that. That is very common. And if we can smell that rightly and give answer to that, then we know that his olfactory nerve is functioning optimal. Then the second cranial nerve is, we call that optic nerve, that involves visual activity, its ability to see shape and detail of the things with our eyes. Therefore, we use very special charts. Actually, this is nowadays is being done with the optician. They have got a special chart and they let you read that from 6 meters or 20 feet to know that if you can read that correctly. If not, if you are not able to read that, then we know that there is myopia or things like that. So eye charts are used during the eye exam to measure visual acuity by checking how well you can see in comparison to other people. Your doctor let you look at the eye chart and read the smallest line of the text that you can see from 20 feet or 6 meters. If you see clarity at 20 feet, if you can read from 6 meters, then you have vision, what you call 6 by 6, or here in Europe they say 20 by 20. That is perfect. And then patient can be tested for the near vision. Near vision, therefore we have got a special chart. You have to read very close to that chart, 25 centimeters. And each eye is to be tested separately. And if patient can read that smallest point on that chart, means that his near vision is okay. So nowadays we refer for this type of test to optician. They have got a special instrument, very well computerized instrument. They can see exactly. But this is a way what we can do in our clinic with this simple test. And then third one is oculomotor nerve. This has got two type of function. You have got muscle function and pupil function. Pupil in our eye, muscle, that how it moves. So with this, we can see the movement of the eyeball, that if eyeball has got good movement, patient is instructed not to move his neck, but he has to move his eyeballs. Doctor is moving his finger and patient has to follow that. That way, we can see the movement of eyeball. Then you have got next nerve that we call trochlear nerve. This is the muscle that is responsible for downward, outward, inward eye movement. Pupil light reflex is also tested with throwing light on the pupil. And if you put light on the pupil, there should be contraction of the pupil. So that way you know that your trochlear nerve is functioning optimal. So with the torch, we put light in the eye to see if there is contraction of the pupil. And that gives us a pretty good idea that nerves, what is connected with the eyeball, is functioning well. It's taking all the information from eye and sending to the brain. And then you have got fifth one, that is trigeminal nerve. Trigeminal nerve has both sensory and motor work function. It can be tested by testing the sensation with very soft cotton bud and or swab on the face. That way, if patient answers yes, he can feel or he can't feel, then you have got very good idea, pretty good idea that trigeminal nerve is intact, is functioning, is okay. And motor component can be tested by asking patient to move his jaw left side or right side, or so that way you know that that nerve is able to give stimulus to that muscles, and that makes it move. That is a motor component of the trigeminal nerve. So you have got sensory, that is to feel, that we have done with the cotton swab. The very light we are putting on the cheeks and on the face, and if patient can feel that. That is the question. If he can feel, it means it's okay. Then you have got one more nerve with the name abducens nerve. This has to do with the eye movements. So we have discussed that already. So then you have got next one is facial nerve. Facial nerve provides both sensory and motor function. Sensory is to feel and motor is to perform. Facial nerve is responsible for moving muscles used for facial expressions. You laugh, you are in sad mood, you can't give that expression. So this has to do something with the facial nerve. So next one is vestibulocochlear nerve. This has to do something with the sensory function what makes you to balance, otherwise patient can get giddiness. So it makes you stable. It's your how we call bringing you in balance. A lot of people, if they get something, a viral infection in the middle ear, then they are having vertigo type of diseases. That has to do with the vestibulocochlear nerve. Then the second one is cochlear. Cochlear part has to do something with the hearing. That cochlear part has to do something with the hearing, and therefore to know if it's functioning okay or not, we have to perform few different tests and very sophisticated instruments they have developed. But in the clinic you have got a fog with different frequencies. So better to send this type of patient to ENT specialist. They have got very sophisticated instrument to measure that in detail. Then we have got glossopharyngeal nerve and vagus nerve, accessory nerve. So these are three what function almost on the same area of our body. So the first one is glossopharyngeal nerve is providing a sense of taste for the upper part of your tongue. And the vagus nerve is sending sensory information from organ in your chest and trunk, such as your heart, intestines, and stimulates the muscles of organs in your chest and trunk, including those that move food through your digestive tract, and that is your peristaltic movements. So that is the function of vagus nerve. So you can very well see if patient is performing that function well or not. Then you have got accessory nerve, and accessory nerve is actually motor nerve that controls the muscles in your neck. It controls the muscle in your neck. These muscles allow you to rotate, to flex, to extend your neck and shoulders. So this is function of your accessory nerve. So if the accessory nerve is not functioning well, then you have got stiffness in rotation, in your extension, things like that. So this can be tested simple way to know if they are functioning optimal or not. Then last, you have got 12th cranial nerve, that is called hypoglossal nerve. Hypoglossal nerve that is responsible for the movement of the most of muscle of your tongue. And that can be tested to ask your patient to rotate tongue to soft palate, to back side, and to left, to right. So that way we see that this hypoglossal nerve is functioning optimal or not. So this gives you a pretty good idea that brain function qua cranial nerves, if he is functioning with his nerve to a different part of the body accurately or not. Last, you have got clinical examination of sensory system. You have got fine sensation, tactile localization, and we must do this with the patient to know if he feels our touch is a simple, very soft touch or not. That is being done with very thin wire type of instrument. There is wire very soft and you are putting, and if patient can feel that touch, and it's being done with closed eye of the patient, so that he doesn't see, but he should feel. And you have got, this was fine sensation, but you have got also crude sensation. Crude sensation, patient should be able to feel, and if he's feeling or not, that is a question. And crude touch, pressure, temperature on the skin, or giving him a little bit pain impulses. That is what we have to see. In hospital, of course, you have got sophisticated instruments, but we do with just giving him something warm on the skin if he is feeling warm or cold, and you can give him pressure with your pen and pencil on a different part of the body. If he is feeling this, we call crude touch, crude sensation. So patient should be able to feel that. If not, then you know that is sensation is not okay. Then you have got a tactile discrimination test. That is that we have got an instrument, what Caesar type of instrument. You can take Caesar, for example, also, that has got two different legs, and putting that on one part, then patient has to feel on the both the points he should feel pain, not that he is feeling here and not here, or feeling here and not here. So that we call tactile discrimination. So he is feeling in whole area same type of sensation. That is tactile discrimination test. After that, then we ask our patient to recognize different type of objects, different type of things what we use in daily life, like pen, coin, pencil, and keychain, key, with closed eyes. He should be able to feel that, yeah, this is coin, this is key. So that also gives us pretty good idea of his sensory organs and coordination. After that, patient should be able to feel different frequencies of a fork. So we bring that different frequencies. You have got special type of fork. We bring that different frequencies just nearby his ear, and patient should feel that. So about 100 hertz frequency we bring just nearby the patient. So if he can feel that, that is a question. So that you should be able to notice. And then we have to have one more test, that is the testing sense of pressure. If we are putting pressure on his body, if he is feeling that. So most of the time, if there is edema or things like that, he might not feel that. And same way we have to see if the patient can have pain sensation. That way we bring very little sharp pin or things like that, needle. So we just give very light prick on the body so that he should feel pain. So bringing that needle or pin on the body, patient should feel pain, sensation of pain. So last, very, very important, that patient should be able to differentiate the difference in temperature. That way we have got two test tubes or two glasses, one filled with hot water, one with cold water. So that way we bring on different part of the body to see if patient can differentiate between hot and cold. So that is the way we can assess functioning of our central nervous system, qua sensory and motoric functioning. So I hope that it has given you pretty good idea that how you can test your patient, and that way you can help him better. You can diagnose him better, and diagnosis is a key to success. Thank you very much. All the very best.